resilience. My name is Ambrosio Barros, and I am the IFAD Country Director for Malawi and Zambia. The recent outbreak of the COVID-19 pandemic has alerted the world of the catastrophic potential of zoonotic diseases and health risk at the human-animal environmental interface. In fact, more than 60% of known human infectious diseases have their sources in animals, whether domestic or wild, as do 75% of emerging human diseases. At the same time, national and regional capacities to respond to current and emerging zoonotic transboundary diseases are very weak. Disease management strategies continue to operate in silos due to a lack of strategic and policy alignment at interministerial and transnational levels. Uncontrolled endemic livestock zoonosis can have huge negative impacts, including increased cost of medical care and loss of revenue due to reduced livestock productivity. They can also reverse the gain of livestock development programs in Africa. Although the One Health approach can help to address this, its rollout has been slow, especially in resourceful countries. But what is the One Health approach? According to the American Center for Disease Control and Prevention, One Health is a collaborative, multi-sectorial, and transdisciplinary approach working at the local, regional, national, and global levels. The goal of the One Health approach is to achieve optimal health outcomes, recognizing the interconnection between people, animals, plants, and the shared environment. This panel discussion will explore the reasons for the slow rollout of the One Health approach in Southern Africa, with a focus on Malawi and Zambia. The panel will propose appropriate interventions that could stimulate the implementation and integration of One Health in national and regional programs for the control of zoonotic and transboundary diseases. I will now give the floor to my colleague Antonio Rota, who is IFAD's Senior Technical Advisor on Livestock Development, and as the moderator will animate this event and introduce our eminent panelists. Thank you. Antonio, over to you.
Thank you. Thank you very much, Ambrosio. Dear participants, as you know, increasing interactions between humans and animals, the erosion of biodiversity, alteration of ecosystems, and climate change are increasingly driving the emergence of infection diseases, most of them from animals, and sometimes with the potential to become pandemics. Meanwhile, the over-reliance on antimicrobials to prevent and combat infectious diseases, protect plants, preserve food, and promote animal growth is giving rise to antimicrobial resistance, normally called AMR, causing superbugs that withstand the drugs designated to kill them, inactivate or slow their growth, and in low and middle income countries, these public health challenges disproportionately affect the poorest households, increase poverty, and hinder development. Agriculture and food play a major role in the emergence and spread of diseases and AMR due to the way food is produced, traded, and consumed. Often seen as health issues, diseases can also disrupt food systems, undermine food security, and destroy people's livelihoods. Zoonotic diseases, which are transmitted between animals and humans, affect more than 2 billion people and cause over 2 million deaths every year. While the costs of SARS, H1N1, and Ebola were in billions, according to the World Bank, the global economy contracted by 4.3% in 2020 due to the COVID-19. That amounts to about 3.6 trillion worth of goods, services, and other output lost. This does not include the many different ways people suffered the downturn through death, illness, loss of livelihood, or disruption of schooling, for example. Foodborne diseases, which can be caused by poor hygiene and animal husbandry mispractices on farm, and AMR also take a toll on economies. The Safe Food Imperative estimate the cost of foodborne diseases at $110 billion in lost productivity and medical expenses in low and middle income countries each year. The World Bank report on drug resistance infection found that the cost could be as high as 3.4 trillion by 2050. Tackling drug-resistant infection is now one of the highest yield investments countries can make. Containing AMR in low and middle income countries cost an estimate of 9 billion annually, but has an annual rate of return of 88% per year. Strong public health systems along the integrated multidisciplinary solutions are needed to prevent, detect, and manage risk from infection diseases in humans and animals, curb AMR, reduce food losses, and ensure food safety. The One Health approach proactively engages different disciplines such as the human medicine, veterinary medicine, and environmental health science to attain optimal health for people, animals, and our environment. One Health can help achieve progress on national and global priorities. Strengthening public health systems at the human-animal-environment interface protects health, agricultural production, and ecosystem services, including food and nutrition security, to disaster reliance and ecotourism, all of which contribute to economic development. The One Health approach promotes synergies at national, regional, and global levels. And the One Health approach, again, is endorsed by international agencies as WHO, FAO, OIE, UNEP, who formed a global alliance. To conclude, One Health strategies are highly cost-effective. One Health improves the effectiveness of core public health systems, substantially reducing morbidity, mortality, and economic costs of outbreak. Thank you very much for listening. And I would launch a discussion on One Health for building resilience. I would like to ask a question to my eminent colleagues, in particular to Dr. Katinka de Balog, who is a specialist on animal health with the FAO Investment Center. Katinka, despite the global recognition of the importance of the One Health approach, its rollout has been particularly slow, especially in Africa. What factors do you think account for this, and how can we catalyze the adoption and implementation of the One Health approach in Africa? Over to you, Katinka. You have 5 minutes.
Yes, thank you very much, Antonio, and thank you, colleagues and participants, for this opportunity. I would like to disagree a bit with the statement. I think the rollout has been accelerated, and especially in the last years. If we look at Africa and the activities and that have been undertaken with regard to One Health. As mentioned, the One Health approach was very much adopted when we faced the threat of highly pathogenic avian influenza, H5N1, which broke out in 2004 in Asia. I would like you to remember there was a high-level meeting, an international conference on avian influenza prevention and control and human influenza pandemic preparedness in Africa, actually already in 2006, which took place in Bamako, Mali, which brought together the various ministers of health and agriculture to discuss emergency preparedness and also how to prevent pandemics by addressing these health issues in the animal health field. And if you remember, with avian influenza, wildlife played a particular role. At that time, countries engaged in what is called the INAPs, the Integrated National Action Plans, to bring together the animal health, the human health, but also communication to address possible pandemics in the future. And this was rolled out in many African countries. And also interministerial committees to address highly pathogenic avian influenza were set up at that time. And for example, in Ethiopia, this committee afterwards changed into Interministerial Zoonosis Committee. We also see that in 2010 in Kenya, the zoonotic disease unit was established, where within the same office you had epidemiologists from the Ministry of Health and the Ministry of Agriculture, Livestock and Fisheries sitting together. And they were very instrumental in conducting outbreak investigations, for example, for trypanosomiasis or rabies. And often rabies is mentioned as the One Health model disease. And as we see that rabies continues to be a priority in African countries, this is often a very good entry point to address this collaboration between sectors. If we also see at the Ebola, and I don't want to take too much of my time, but the Ebola in West Africa between 2014 and 16 brought the establishment of the Africa Centers for Disease Control and Prevention in 2016. And in 2018, the One Health program was established. And if you look at the website there, the aim of this One Health program is to make Africa safer and healthier for humans, animals, but also plants and their shared environment. So here we already see, the broad One Health concept being embraced. You mentioned AMR, antimicrobial resistance, and nowadays many countries within Africa are developing the national action plans to address AMR under One Health umbrella. If we look at education and capacity building is certainly key for promoting One Health, we see the OSEA networks, and these are the One Health Central and Eastern African networks that were set up between faculties of veterinary medicine and public health. And they are very instrumental to create the experts for the future. And then just coming in, what could catalyze, how could we address the complex issues with regard to zoonotic diseases and AMR and other health threats in Africa? I just want to finalize and mention 3 points. We need good coordination mechanisms. So policies and mechanisms need to be in place for enhancing this collaboration. And this is not only with animal health, human health, but we also need to integrate wildlife, the environment, natural resources. Sometimes ministries of tourism can play an important role if we think of wildlife, and especially in Southern Africa, but also to involve the private sector. We need good policies and mechanisms in place for this coordination, and then the capacity development. And here this can be at university level, but also at in-service training. For example, to have professionals that are already working for the ministries to get better acquainted with the One Health approach. And then thirdly, funding. We need funding for these mechanisms. Initially, sometimes outside funding can catalyze the initial activities, but then countries need to have, streamlined funding for the One Health approach. And here, therefore, also ministries of finance have an important role to play. So thank you very much. Thank you.
Thank you, Katinka. I love the idea that you challenged the question. You provided a very comprehensive scenario and a situation And actually, I'm glad to see that the rollout is not so slow, but things are happening. So let's ask people, experts, African experts in the field, their voice, and listening to them. I would like to invite Dr. Nyunga to brief us a little bit and outline the major zoonotic diseases in Africa in the past 10 years. What was the cost of not intervening because of the current risk and infection rates? Dr. Nyunga, the floor is yours.
Thank you so much, Antonio. Yes, Africa for the past decade, has been hit, in fact, severely hit by a number of zoonoses, but I'll just, highlight the key major ones. The first one, of course, is the current pandemic, that's COVID-19. Apart from that, we had the Ebola outbreaks, especially in East Africa, Rift Valley fever, H5N1, this is a highly pathogenic avian influenza, and also pandemic avian influenza, which is H1N1. And also we had the leptospirosis, that was in 2017, South Africa, which was a big problem. Of course, rabies, which is all over the countries, Zika viruses, Rift Valley fever, as already mentioned, but also not forgetting some of the neglected ones like tinea, soria, this is pork measles. All these things have been, a big problem in Africa. There are quite a number of them, but because of the limited time, probably I can just allude to those few ones. Now, the key question is what you have said. What is the cost of living or letting these diseases just go unnoticed? I would divide the losses or the impacts into three key categories. The first, I would say, is the direct losses as a result of mortality and morbidity. This is both in animals and humans. The second would be social losses that emanate from from diseases or from these not diseases. A good example is if a person is sick and that person will say heading some animals, it will mean you have no time to look for those animals. As a result, the impacts will be not only on the human, but also on the animals. Apart from that, medication that is used to treat those diseases, again, both in humans and animals. All those things are social losses that are accompanied with these diseases. In addition to that, also is the time factor which is lost. Very productive time is lost when either an animal or a human is sick. So all those things should be quantified. And from literature, based on the two that I've said, it is estimated that close to 800 billion United States dollars is lost due to this pandemic annually in the past decade. And again, it has contributed to roughly 227 million years of health life, meaning if you a combination of sick animals and humans during the past decade contributed almost to 227 million years. So if you can convert how much financial loss could be accrued from 227 million years, you can see how massive it is. And the last impact that I want to touch base is now on the future losses that arise from either mortality or morbidity. A good example is, say, an animal which was very productive, dies because of a zoonotic disease. An example could be maybe an anthrax. And that animal is a young animal, which means the future generation that would have come from that particular animal will never be there. And that's a big loss. And that one is cumulative because the offsprings would have bared other offsprings, et cetera, et cetera. So it's exponential loss, so to say. Similarly, if mortalities occur in humans, it's the same. That human would have been productive, produces young ones, would have contributed massively to the development of the region, especially the African region. So there are quite a lot of them. Say it again.
We have to move because the time is running. But okay. I thank you, Dr. Nyunga, Deputy Director of Animal Health in Malawi, for your really important points. And perhaps Dr. Nguyen would like to complement from ILRI, the International Livestock Research Institute point of view, what Dr. Nyunga just illustrated. Would you like to? Yeah, thank you. Thank you.
Yes, thank you, Dr. Rota. Good afternoon, participants, dear panelists. Thank you for the opportunity to share some thoughts from INRI, where I'm working at the moment, based in Kenya, in Nairobi. I think that Dr. Nyunga gave a very nice overview on the impact of zoonotic disease in Africa, including his country, from regional perspective, because we work more at regional and international side. I just want to say that in addition to zoonotic diseases issue is one of the main pillar of One Health approach. We should not forget the other two that Antonio mentioned very nicely from the beginning, including AMR and food safety. And food safety, unfortunately, is also a very important public health issue linked to livestock and also other sectors. Recently, it was shown that it actually caused the loss of $33 million a year. And actually, this is equivalent to the big three infectious diseases, HIV/AIDS, tuberculosis, and malaria. And also, it's very unfortunate to see that Africa, part of developing countries, suffer a lot from that. 1/3 of this global burden of foodborne diseases are in Africa. And Antonio, you asked about money. So in terms of money, you mentioned that more than 1 billion lost per year at global level. And Africa alone, 20 billion a year lost due to the foodborne diseases in this continent. So you can break down afterwards in the country level, but actually this is really a big issue that we need to address. This additional information. And coming back to zoonotic disease, I think that we also need to bring it down to the country level. For example, our research on Rift Valley fever showing that each year Kenya actually lose $32 million due to Rift Valley fever, Zimmerine infectious disease. So I think that I stop here for the question.
Thank you, Hanga. Hanga is the co-leader of the Animal and Human Health Program in ILRI. But let's listen a little bit from the decision maker, the politicians, the people who can really make a change in the country. And I invite the Honorable Professor Nkando Luo to tell us a little bit, what is the role of the national government in promoting One Health approach? Professor Luo is the former Minister of Agriculture of Zambia. Professor Luo, the floor is yours. Over. You are mute.
Thank you very much, Antonio. And just to recap that when we're talking about the One Health approach, really what governments need to appreciate is that it's a collaborative, interdisciplinary, and transdisciplinary for us to be able to achieve this optimal health in terms of outcomes. And as a result of that, a country must also appreciate the interconnectedness of what we are talking about. And the approach, therefore, has to ensure that this collaboration happens from the community level where the livestock is up to the global level. And unfortunately, as our representative of FAO was talking, I can tell you as the immediate past Minister of Fisheries and Livestock in Zambia, there is a disconnect. We may have some very good examples, maybe at the national level, but that doesn't transcend to the local level. And as you actually move and roll out this particular program, you must have an approach that assembles the medical experts, the veterinary experts, the people, and I'm glad somebody mentioned about tourism, because wildlife is actually housed in the ministries of tourism in most governments, and also people from environmental health. But not even forgetting, for example, the ministry in charge of land and natural resources, because some of these diseases are actually found in the soil. So I have some very key messages that I think I need to bring to the attention of the group. And at national level, we need to domesticate this One Health approach in terms of policy and legislation. We need to do some strategic thinking where strategies and implementation and action plans actually speak to this One Health approach. And the rollout must also be embedded in that. And what I think importantly is that there have to be reforms in all countries in Africa, and setting up of systems that will align the different ministries which are key players. And for Zambia, as an example, the ministries that I see are very critical is health, agriculture, and where there's fisheries and livestock, it also comes in there, ministries of local government, ministries of lands and natural resources, environment, as well as the planning and finance ministry. These must come to the table and set up some kind of mechanism that is important. And also the country must have established a sustainable financing mechanism, which may bring all these activities together and the implementation plans. And importantly, is a platform of dialogue where not only the government speak, but all the key players at local level, the farmers, the private sector, the government, as well as the international groups that have interest in this particular area. And if we look at looking at regional level, there must be some efforts of collaboration between the different countries. And this is not happening at all. And for example, governments must ensure that what they signed to of having cordon lines and active surveillance is achieved. And you don't see this happening. I can give you an example in Zambia that one of the diseases that the CBPP, which is a big problem for us, is because the Angolan are not active in terms of surveillance on the borders, and there's no discussion between countries. Therefore, we need to create a platform at regional level that will promote dialogue between nations and also between the global people that are coming on the table, like we are discussing now, the FAO, IFAD, and so on, the World Bank. And we need to develop a communication strategy and systems that ensure collaboration, information sharing across nations and globally. That way, we are going to achieve a lot more. As at now, this is an academic exercise, but on ground, it is not happening. And I would like to engage further because I'm one of the people that is really interested to see livestock development flourish, and we achieve a lot more. And this is an important area in terms of economic development in any country. So
thank you.
There
Professor
we are.
Your intervention was really highly appreciated. Your word of wisdom and the proposal you made are really fundamental, and I thank you personally for that. You mentioned in your very clear intervention the role that the private sector may play. I'm convinced that without the private sector, the farmer organization, it will be impossible to implement a viable, sustainable One Health. So yes. What I'm inviting Mr. Hussein Jakura, who is the CEO, the director of the Nyama World, a large company, agro-processor, producer of livestock in Malawi. So, Mr. Jakura, what is the role of the private sector in implementing One Health? Better than you, I don't know who can talk about that. Thank you.
Thank you very much, Antonio. Greetings of peace and blessings to everyone from Mzuzu in Malawi. I think the role of the private sector is vital if you are to achieve, as the Honorable Professor and the ex-Honorable Minister of Zambia spoke. I personally feel that as private sector, we have a moral and ethical duty when it comes to producers and processors. Because if you look at the region, and if we specifically focus on Zambia and Malawi, Zambia has an urbanized scenario and Malawi has a lot of people in the rural areas. And the smallholder farmer is the key producer, whereas the private sector is the processor. So for me, the first key guideline to achieve One Health is, do you eat yourself what you process and what you produce? With food security in mind, in the whole value chain, with traceability all the way from the farm to the fork. For achieving this, the purpose of this get together, not just to mere talk as the Honorable Professor talked about, is that how do we achieve it? What we have seen from our experience, having worked with a lot of smallholder farmers in the northern region of Malawi, as far as livestock goes, the best approach, I feel, is the donors and all the stakeholders must have a platform, which is the normal platform where private sector and public sector work. It's given 3 Ps. I feel there should be 4 Ps. The 4 Ps should be public sector, private sector, producer. The producer must be part of that in this partnership. And the implementers of policy should be private sector and the producer. If we really want to see that One Health is adopted and implemented the way the policymakers would like to see this implemented. The role of the public sector must be facilitation, monitor, and guide, together with donors and other stakeholders. NGOs, I'm not anti-NGO, but I feel the implementers, the ones who can really make this happen, is the producer and the private sector or the processor who's doing it. So NGO's role should be again be similar to facilitation, like the way the public sector comes in. Also, I feel the schools must have One Health in their curriculum. It is vital that every person, no matter which sector that person comes from, is reminded by their own child about One Health. Then nationalism, it should be something, as the Honorable Professor alluded, that it should be something which should be promoted nationally, regionally, on the continent. See, our own experience in our company and the 11,000 farmers who are attached to us in the last 3 years, due to foot and mouth disease, we lost together probably between $15 to $20 million. Now, if there was a platform where we can try and see that all the stakeholders work on a situation, that we can try and create green zones within Malawi, within Zambia, and in the region, there's such a potential. Obviously, when we are exporting within the region, when we are exporting out to the Middle East, which are viable countries for our part of the world, it would bring in tremendous potential. If we are able to speak the language of One Health, it would attract any buyer in the region as well as off the continent. One other thing which I would like to remind ourselves that Africa is blessed with immense natural resources. We must try and follow what was practiced for centuries by the producer, a holistic approach. If we look at the health situation before and now, it confirms that whilst we might not have had the education and the transformation which we had in the world now, but before, health used to be much better than what we see in today's world. Thank you.
Thank you. If you allow me, Hussein, I really appreciate also the role that the private sector. There are other stakeholders very important. One are the research institutes and the international agencies. I would like to really listen from the two representatives on the panel, Dr. Nguyen and Katinka, in the order. What is the role of the research institute? What is the role of the donors in United Nations to support One Health approach in Africa? Dr. Nguyen, the floor is yours.
Thank you very much, Dr. Rota. Actually, INRI as a member of CGIAR systems is the only institute working on animal health and livestock in developing countries. We have been working with many countries in Africa in particular to develop this One Health approach in controlling zoonotic disease, AMR, food safety, etc. through research, because our institute is actually is an information, generations evidence institution. So I think that for international research institute or generally regional international organization, we need to continue to help countries in Africa to build up the capacity in One Health from different levels, either institutional or individual levels, because facing this complex health issue using One Health approach, you need capacity for different partners, like Hussein said, from private sector, but also for farmers, for researchers at university and research institute, and also other sectors. So I see that the key is really the coordination among institutions in each of the country, but also from regionally. Katinka mentioned that One Health has been taken up in Africa. We have many initiatives. Many countries are keen to take up this approach, but I think that we need more and more to improve the coordination mechanism so that we can optimize the resource use for this area. From a research point of view, by building the capacity through research, you can also build up a very good network at regional level in One Health. So we have here different batch of One Health students who become the champions in each of the country, and they can work together across the continent to adopt and develop the take up this One Health approach in different countries. So I think that is very key, and we are seeing that happening. In Africa, for example, we have One Health Center for Africa funded by BMZ Germany, hosted here at INRI, for example. We work with several countries in East and Southern Africa, and from that we train PhD students, also hosting different interns to develop this capacity. The second network I would mention, actually, Katinka, you mentioned OSHA, and recently they changed into the AfroHUN, African One Health University Network. It's a large network, and research institute need to collaborate with them as well. Another example, Africa One Aspire, is more between Francophone and English-speaking community in Africa, have been working also in One Health. And I see that now, I see the future of this continent, because the capacity is being built up by different nationals, by their own country, but also by international organizations like us. And we need to have a very good coordination mechanism so that to bring all these people together to work. And by doing so, they can learn each other and can address this One Health issue in Africa.
Thank you, Dr. Nguyen. And Katinka, the role of the UN, you represent FAO, and I guess as well WHO and other institutions who form this alliance at a global level. So what would you like to tell the participants and the panel about that?
Thank you for this opportunity. Yes, I would like to mention here, for example, the tripartite, as you mentioned, FAO, WHO, and also the World Organization for Animal Health, OIE. We jointly developed, for example, the Zoonosis Guide, which provides guidance to countries on how to establish these multi-sectoral coordination mechanisms and roll out the programs for zoonotic diseases. The same for antimicrobial resistance at international level. We have global guidance, we have assessments of laboratories. So there are many tools that have been developed by the various organizations that countries can use for various aspects. And these tools only make use when countries actually use them. And they are available, they're normally accessible via our websites, but also the international organizations can facilitate the technical expertise, as well as in many ways also resource mobilization. And when we talk about regional level, and Professor Loh very clearly mentioned, the coordination between countries and cross-border activities. And here, for example, we are often able to facilitate, for example, memorandums of understanding between countries or working closely with the regional economic communities, like for Zambia and Malawi, SADC, could play a very important role in bringing the different countries together and bringing this high-level commitment. As we have found that to enhance the coordination, one thing is you need this high-level commitment, but you also need shared objectives and shared benefits. So here again, the division of resources and having ministries of planning and finances involved is crucial in getting the long-term rollout of these activities. And the international organizations are there to assist countries, and we also can provide examples and experiences from, for example, Asia or Latin America. So reaching across continents, the experiences that are there that can be shared with Africa. And just to mention that FAO has set up the ECTAD, the Emergency Center for Transboundary Animal Diseases, and here a program of ISAVET, which is the in-service training on applied epidemiology that can help countries, especially nowadays, in outbreak investigations, rapid response. But just to remind you, we need to work on prevention. We need to prevent that these pandemics happen. And therefore, this requires the structural coordination between the different sectors, looking at animal production systems. And here again, also the private sector is very important. So clearly, the international organizations are standby to assist the countries and the region. Thank you.
Thank you very much, Katinga. I am so happy to see that we have 81 participants who joined this discussion. So let's give something to them. And my last question to the panel, and I'm asking for flash, short points, is about, okay, we learned so much today, and given the recognition of the need to implement regional programs, how would a One Health regional program look like? Professor Luo, you already mentioned in your intervention some elements. Would you like to highlight some few points? Perhaps then Dr. Nyunga or Katinka and everybody would like to give some bullet points to our participants to imagine how a regional program would look like. Over to you, Professor Luo. Would you like to give us some few points? Over. You are mute again. You're on mute. Sorry.
I thank you very much for this opportunity. I think I was reading somewhere where there was a suggestion that the regional programs should be housed in SADC and the AU, and I don't think it should be that, because those institutions are already loaded. So you risk losing the discussion that we're having here. So it may be a good idea to just set up a platform or an institution which can be housed in one of the countries, and then all these suggestions we made of setting up some protocols, some communication strategies where you can reach everybody and so on. If I borrow one of the programs that I belong to, what they have done to promote research in Africa so that African countries start using research data to make decisions, what they have appointed is a high-level representative. And this high-level representative is used to go to countries to have this discussion and to make sure that the rollout of this starts from the grassroots, because the farmers, most of them, don't have the knowledge and the education that we have. So the discussion must start there for them to understand the dangers of zoonotic infections, the dangers of not intervening, and so on. So I think that we need to start thinking about a regional office, small, which can now start pushing this rollout. And of course, it will attract finances. And therefore, we need to look at a financing model that finances these activities. And I would like to suggest that this particular effort, although I come from the health sector by profession, should not be a preserve of the health sector. This is why it has not rolled out in Africa, because we health professionals tend to be selfish and think we're the only ones who know health. But I think it should be, even if you set up a committee that is going to spearhead the rollout, the chairship must be rotational. Sometimes it has to be people from lands, from agriculture, from tourism, so that the health sector doesn't think that they have the monopoly of knowledge. I think it's a jigsaw puzzle that should bring the different brains together and make sure that this program is rolled out. And personally, I'll be looking forward to see how this manifests and how this program will move to the next level. Thank you.
Thank you. Thank you very much. Dr. Nyunga, do you agree with our eminent politician, I would say? Dr. Nyunga, would you like do you agree? Do you see also the same happening? Perhaps I give the floor to Katinka. Is the UN system, is the tripartite? I give you the floor back, Dr. Nyunga. Sorry, Katinka. Dr. Nyunga, do you agree with what Professor Luo just depicted as a possibility for the future of a regional platform?
Yeah. Thank you, Antonio. In fact, it's
Very
interesting
briefly.
what the prof has said. But again, I can see that as a long-term measure to have an independent institution that should handle, One Health issues, because I know it will mean infrastructure development, et cetera, et cetera. However, in my mind, I had either this, regional collaboration center being housed either at CDC Africa, or we can use the SADC block as a coordinating center. But to start now, establishing, it may take time, but I thought you can just get ourselves attached to one of the already existing structures. However, the personnel to man that particular unit should come from multi-sectoral agencies like health, agriculture, tourism, exactly what the prof said. I think I would go for that. Unless the resources are readily available, that maybe you can establish that center, but it's a bit tricky. Thank you.
Thank you very much. I was asking Katinka, is the UN, is the tripartite alliance ready to support these efforts?
Well, definitely. I think at global level, the tripartite has come a long way, and we have developed this very close collaboration. And there are many of the issues discussed today, like zoonotic diseases, antimicrobial resistance, but also within the zoonotic diseases, the emerging versus the endemic diseases and food safety issues. And here we have also the Codex Alimentarius, are mechanisms where we work very closely together. But if we look at Africa, it is important to get this high-level political commitment. And therefore, the question is either to think at really high-level ministerial, presidential level, and here we have the regional economic communities as a mechanism. And Professor Luo, you mentioned that to have it more as a separate union. I think it might be important to have the agreement, the political commitment at high level, and then to see how to roll it out more at a smaller level, to have an institution taking the lead and facilitating this important way forward for One Health. So with this, the international organizations stand by to assist, and also the World Bank has an interest to provide assistance to countries financially to set up these mechanisms and assist them. Thank you.
Thank you very much. I see the time is running. Dr. Guyena, I'm sorry, and Hussein, I'm sorry. I would like to close this panel because I don't want to be cut off. Therefore, it is my great pleasure to invite my director, my supervisor to this panel. Dr. Triki Turaya is the director of the Sustainable Markets and Institution Division in IFAD. And I'm sure if you mentioned, Katinka, the World Bank, but the private sector, the research institution like ILRI, IFAD, will support the idea of establishing a regional platform. So therefore, it is my pleasure to invite to the floor Mrs. Turaya to give us some closing remarks after this exciting panel with 86 participants. Thank you for all of you for being with us. Turaya, the floor is yours.
Thank you very much, Antonio. So ladies and gentlemen, distinguishing participants and panelists, I would like to start by thanking the AGRF organizers for giving us the opportunity to have this very interesting discussion about a very timely topic, but also thank our panelists for their excellent intervention and for sharing their insights and views. The event today has focused on One Health as an effective approach to build resilience against the insurgence of new pandemic threats, but also as a means to address the fast-growing problem with antimicrobial resistance, the spreading of foodborne diseases, and overall with food security and safety. I've been following very closely the discussion, although I'm not a veterinarian by training, but I found the discussion extremely relevant, especially with what we've been living and the COVID-19 crisis over the past 2 years. So I would like to use these closing remarks to share with you what I feel are some of my personal takeaway points from this discussion that with Antonio probably would try to push also internally. First, the One Health approach engages medical, veterinary, environment, and socioeconomic, as well as communication experts to enhance the health of people, animals, and ecosystems. This obviously requires a shift from a disease-focused approach to more system-based approach. It also includes refocusing from disease treatment and control to disease prevention, surveillance, and preparedness, especially relevant for emerging zoonotic diseases and antimicrobial resistance, which is one of the top 10 urgent global health challenges. Obviously, that means that we need to learn to work differently, but also to work better together. Second, crises such as COVID-19 have demonstrated the need to involve wider multidisciplinary and intersectional areas, including plants, food security, land use change, and wildlife trade in dealings with challenges. It's only when these drivers are addressed through research and good policy formulation, and I was happy that this issue was brought up earlier in the discussion, that we would achieve transformative change to prevent future pandemics. Strengthened research, science, policy interface, supported by sustained targeted investments, working locally, nationally, and globally are needed to continue strengthening health and food systems, improving animal and human disease surveillance and diagnostics, and enhancing emergency preparedness and response, especially in fragile countries. Third, I've been hearing a lot about the One Health approach, which is poised to play a crucial role to achieve an integrated and preventive strategy on livestock-associated human health risk, and is so doing in contributing to the achievement of SDG 3, which aims to ensure health and well-being for all at all stages while contributing to food security, which is SDG 2. But in order to fully and successfully operationalize the One Health approach, there is a need for an agreed definition of One Health among key global, regional, and national institutions. Efforts to build One Health institutions from the ground up, comparative case studies of what works and what doesn't, and high-level global support for research, training, and career opportunities would all help to enable the One Health. This calls for a multi-stakeholder One Health regional, sub-regional platform. Such a platform would be used to discuss emerging issues around human and livestock diseases, raise awareness on the correct use of antibiotics. Moreover, there is a need for increasing investments that support national and transboundary disease control measures, such as improving national and regional capacity to monitor, predict, prepare, and respond to disease outbreak. As a leading institution with the UN mandate to eradicate poverty and hunger by investing in poor rural people through financial and technical assistance to agriculture and rural development projects in developing member states, IFAD stands ready to support this agenda. We are ready to work with our partners that we heard today, but also with other entities, including UN specialized agencies, other IFIs, national and international research institutes, farm organizations, and the private sector to assist member states to invest in One Health, implement platforms, strengthen veterinary services capacity for a more efficient preparedness in case of outbreak of zoonotic diseases, and to reduce the impact of antimicrobial resistance. Thank you very much. Over to you, Antonio.
Great, Thuraya. Thank you very much. I think we are sharp on time, and it has been a privilege to have such eminent panelists and colleagues during the discussion. We learned a lot today, and there is this this willingness really to collaborate and work all together to implement One Health approach at continental, regional, and national level. Therefore, thank you to all the participants to really join us today for this discussion. And as I learned from my brother Hussein, God bless you, and have a very nice continuation in attending AGRF events, an event overall that is key for decision making, for learning, and for taking action to make the African continent the leader, which in my opinion has the potential and should be because of so much potential and so much expertise as we have seen today. So thank you very much and have a very pleasant day. Over.
Thank you. Bye-bye.
Thank you.
Thank you. Bye-bye.
Bye.
Thank you, Professor.